I am Dina Diorio. I'm the Mecklenburg County Manager. I'm joined today by Gibbie Harris, our Public Health Director, Deputy Chief Estes from CMPD. We're also joined by Reverend Jordan B. Boyd, the pastor of Rockwell AME Zion Church, and Dr. Ricky Woods of First Baptist Church West, who are going to be sharing some very important information to our community today. As you know, last night at the Board of County Commissioner meeting, we announced that we are closing our parks and greenways to vehicular traffic only. We've been getting a lot of emails and a lot of feedback about this, but I want to make it clear that these facilities are not closed to people. People can still enjoy them, people should use them, but we want to make sure that we limit as many people as we possibly can in a single location, which is why we're closing those facilities to vehicular traffic. We are working with CMPD and the Sheriff's Office to do enforcement around that, to make sure that we continue to have social distancing and to enforce parking rules in and around those locations. This applies to county parks only. It does not apply to the towns that are in the individual parks. So while these parking lot closures only apply to certain Mecklenburg County park and recreation parks, the town's parks parking lots will remain open for the time being, and they will continue to patrol, monitor, and evaluate physical and social distancing requirements in their parks to ensure compliance on behalf of safety and health of all of their patrons. So again, the town parks are not closing their parking lots at this time, but they will continue to monitor and make decisions accordingly. The next thing I wanted to cover very briefly is last night at the Board of County Commissioner meeting, the board adopted two small business loan funds that are going to be available to small businesses starting on Monday. The first is a $5 million loan fund for businesses that employ less than 50 full-time employees. There's a minimum loan of $5,000 and the maximum loan is $35,000. These are 3% interest loans with 10 years payback, and the first year is principal and interest only. And the second is a micro business stabilization fund, which is a $1 million loan fund and is for organizations or businesses that have less than 5 people. And these loans are up to $10,000 and have a 0% interest rate, and that's a 3-year maturity. So we want to encourage as many businesses as possible who think they may be eligible to apply for these loan funds, and you'll be able to find information about those on our website. The other thing I wanted to go over briefly is we will be updating our order, our proclamation, our stay-at-home proclamation, to extend from April 16th, 2020 to April 29th, 2020, which is when the governor's order expires. We don't plan on any other revisions to the order except to extend the time frame from April 16th to April 29th. And the final thing I wanted to touch on briefly, and I talked about this last night at the Board of County Commissioner meeting, is that we really do need healthcare workers who are willing to, whether you're retired or you transitioned into a new line of work, who may want to come back and help with this healthcare crisis. We need doctors, we need nurses, we need medical assistants, we need EMTs, paramedics. And so we really have a lot of opportunity for people to help us out. And you can do that if you're interested by going to this website called TERMS, which is TERMS at emnc.org. I'll say it again. It is TERMS.emnc.org. That is a state emergency management website. You can register there. You can put all of your credentials in there, and the state will vet your credentials, vet your licensing, and then approve you to work in our system. So again, we need everybody to be part of our solution. We need everybody to help us out any way that they can. And so if you do have the time and want to help, we would certainly appreciate that. I'm going to turn the podium over to Gibbie now, but I do want to remind everybody to please comply with the stay-at-home order and stay at home. Thank you.
Good afternoon. In Mecklenburg County, we now have 839 laboratory-confirmed cases of COVID-19, and we have had 9 deaths in our community to date. There was a question about nursing home facilities. We have 2 facilities who have confirmed outbreaks in Mecklenburg County. For this particular incident, an outbreak is considered to be 2 or more individuals who have been diagnosed with COVID-19. We have another facility that we're working with right now, and they are under investigation. What I want to reemphasize is that a month and a half to 2 months ago, we worked with our long-term care facilities in this community to restrict visitation and to do the things that we know will help them maintain the safety and health of their population. They have been doing this in very strict ways. We've been working with them on that. They're communicating with us regularly. The facilities that have had outbreaks have been doing what they need to do to protect the rest of the individuals in their population. The other thing that I wanted to talk about is some of the modeling that we've been doing in Mecklenburg County. There have been lots of questions about our models, how we're doing that, what numbers we're using. There are a couple of points that I want to make. We have built the modeling that we're using in this community based on methods that were developed by a team of researchers at the University of Pennsylvania. The CDC has also used this model. We're working with our partners at Atrium and Novant, and it requires data from all three of our systems to run these models. We've adjusted the models with our local data and are monitoring the projections daily. Every time we put in new data and adjust the assumptions based on what we're seeing in our community, the forecasts can shift. These models are not unlike what you see when we have a hurricane. When you see models from a hurricane, you see where the hurricane is and then the cone that goes out from the hurricane. That means that it could happen anywhere within that cone based on the modeling that they're able to do. And the further you go out with the modeling, the wider that cone becomes. That's what we're dealing with in this situation. We have limited data, and we're using what we're seeing in other communities to help us with that modeling. But you have to know that this is a moving target for us, and we're doing the best we can with what we have. What we've seen from our models so far, we know we have widespread community transmission and some increased testing in our community. We expect our counts to continue rising for those reasons. We have not yet seen the dramatic acceleration in cases that we expected, which is indicating that we have some progress based on our social distancing and our stay-at-home order. That is excellent news for us in this community. It looks like the curve is beginning to flatten. But it also means that we have to continue social and physical distancing. And in fact, we need to increase it and to further progress in the numbers that we're looking at. So although we are seeing improvements in our models and we're seeing some flattening of the curve, it's because of what you're doing in the community and the way that you're complying with our stay-at-home order. It's absolutely necessary that you continue to comply with that. Even with the current stay-at-home order and levels of social distancing, we will start to see our healthcare systems becoming overwhelmed in early to mid-May. Those are the projections at this point in time. We're continuing to work with our hospital systems to look at how we can mitigate that situation and how we can address the increasing numbers that we expect to see at that time. As you heard last night, we'll have inadequate beds, staffing needs, as the manager just mentioned, the need for additional supplies and life-saving ventilators. We are continuing to work on those issues with our local community, through the emergency management department here in the county, as well as with the state and the federal government, and we'll continue to look for ways to mitigate that. I do want to talk just briefly about some specific issues that we're seeing in our data. As we've talked about before, over 70% of our cases are in individuals between the ages of 20 and 59. This is our younger population. This is our more mobile population. These are the individuals who we may be seeing out in the community more. We've discovered that because our numbers are so high in this area, that we've got to look at how we message to that community. We mentioned last night that we will be working with influencers through social media to get messages out specifically to this population. We'll also be looking at specific radio programs that will target this population as well. The other area that I want to talk about is our African American community. As you've seen to date, 48% of our positives are in that population. And most of those, or a good majority of those, are in the 60 and older population of folks with underlying health conditions. We've also seen that over 50% of our deaths have been among African Americans in our community. You're starting to hear more about this across the country. And several points that I want to make. This should not be surprising to us. When we look at our demographics and our data in this community, this is the population that is hardest hit by all of the chronic diseases in our community. When we look at other infections like HIV, this is where we see it in our community. This is the population where we are seeing the biggest challenges around social determinants, jobs, housing, education. So why should it be surprising that COVID-19 is treating this population any differently? This is just symptomatic of the problems we have in our system for this particular population in our community. So we have got to look at ways to increase access to both testing and care, as well as getting the message out in ways that this community can receive. As we're trying to do that, we will be working with radio stations that specifically target this particular population. In addition to that, we're working on some print material that we can make available through churches and others in our community that this community trusts for their messaging to make sure that we're getting the messages out in the ways that we need to. This is critical if we're going to be able to serve this community as well as everyone else in our county. So I want you to think strategically and critically about what you do day in and day out and how you can be a part of the community solution. This is not about each of us individually. It's about how we're working in our communities. Thank you.
Thank you, Gibbie. At this time, I'd like to ask Reverend Boyd and Dr. Woods to come to the podium and give a special message to our community. Thank you.
Good afternoon, everyone. Thank you for allowing us to come before you today and to echo some of the sentiments that have been spoken today by our county manager and our public health director. We are to be very mindful that this is indeed a very serious virus that we are indeed dealing with, and it is to be taken very seriously, and the recommendations are to be taken very seriously. To my colleagues in the faith community, I know that we all are experiencing the difficulty of how we stay connected with our communities, our faith communities, our families, as well as our extended communities and families. I know it's been difficult and trying, but I want to ask that we continue to encourage our people and to be forthright for ourselves and lead in such a way that protects those who are, in this case, the least and the most vulnerable and the least likely to have the kind of access and opportunities to the health care that are needed. As is indicated by the health director, we too are encouraging our county manager and health director, who is working really, really hard to address this pandemic that has come upon us, and helping to respond, as we know, in a way to the community, to partner and leverage the partnerships that we have to bring to the community the kind of resources that would help minimize the deaths as well as the positives that we are seeing in the African American community. I want to encourage those who are pushing forward with this Easter service coming forward to still have some kind of service. I'm reminded of Paul's words in Corinthians when he says that while in the freedom that we have in Christ makes available to us everything, that not all things are beneficial to us. And that while everything is available to us, not everything is edifying for us. This indeed is a moment where it is not beneficial for us to gather in any form in the way of protecting our people. And that is what we are about, protecting our people, not only in a spiritual way, but in a temporal way. I encourage everyone to know that we are, as we work together, going to get through this by God's grace as we continue to work together. Thank you. Thank you for listening. Thank you for being responsive to our healthcare leaders in such a time as this. May God bless us all. In your Son's name we pray. Amen.
Good evening. I want to share my support of the county's order to stay at home. Whether you are a part of a faith tradition or you do not practice any particular faith tradition. For those who do practice in various faith traditions, we know that this coming weekend is one of the high holy days, both for our Jewish brothers and sisters as they share in Passover, as well as for the Christian community. This is not a time, again, where we should be gathering in mass meetings in public because of the dangers of further spread of this virus. Although we are seeing some effect of the stay-at-home order of flattening the curve, this is not a time for early celebrations. It is a time for us to continue to be diligent in staying at home, that we can continue to do the things that we need to do, both virtually or by phone or whatever methods that we might use. So again, I would encourage you, please, to follow that order and to support the order that has come from our county manager and from our health director and make our law enforcement's jobs much easier. Thank you.
Thank you, Reverend Boyd and Dr. Woods. At this time, I'll ask Deputy Chief Estes from CMPD to come to the podium and give you an update on enforcement activities. Thank you.
Thank you, everyone. I wanted to echo a few sentiments, particularly that we heard from the clergy here today and also from the county manager. This is not a time to celebrate, but this is a time in which we double down our efforts and stay at home to ensure that we protect ourselves and protect each other. So far on the enforcement end of things, I'm happy and pleased to report by and large we're getting good responses. We are seeing some who aren't, and we're addressing those. Particularly this weekend, as you go out to the parks, remember, parking lots are closed. They are open for walk-ins. But again, social distancing is important. You'll be seeing a lot more response from CMPD as well as the Sheriff's Office and park rangers to ensure that that takes place. We also want to remind businesses and others that if you're operating outside of the proclamation or orders that you should close. We are also following up on businesses as well. So for those of you who have adhered to the ordinances, well done. We're proud of you. For those who have not, now is the time to step up. Just as we're beginning to see a glimmer of hope, it's now time to take that banner and move forward. Thank you.
Thank you, Deputy Chief. At this time, we will take questions. I'm going to try to moderate this over the cell phone, so just give me a little patience there. So who's first?
Hi, this is Glenn Burkett with the New City Metro. Ms. Pitcher said that it should not be a surprise that the African-American community was disproportionately impacted given some of the health concerns. But for a long time, the county did deny that any particular community was being impacted. Do you think we have lost valuable time in letting the African-American community know what is happening?
I am hoping that the entire community has been listening to the message that we're all vulnerable in this situation. Unfortunately, in the early days, we did not have enough data that really helped us understand what we were seeing. And as you can see, even though we recognized this last week, we're just starting to see the recognition of this situation in other parts of the country. So I'm not sure we could have seen it earlier than this. I guess if you think about it, we should have suspected that this would be something that would happen based on the fact that we know what the issues are in the African American community from a health perspective. But we were moving fast on trying to deal with the virus, and until the numbers showed up, it was hard to see that this was what was going on.
Channel 9. I want some more information on the influencers that are being hired. Who are these people? How much are they being paid? What platforms are they using? And when will the posts start rolling out?
So as someone who unfortunately doesn't use a lot of social media, I probably cannot answer those questions terribly well. We are working with a firm that is helping us with this, that does this work in our community. They put together a plan for us. I'm not sure, I don't have the list of influencers that we're considering, but we're giving them information about the specific populations that we're trying to get our messages to, and they're helping us find the best ones out there. And what I will say is we're getting started later this week. Those messages should come out by the end of the week. And then we will assess how that's going, and if we need to make some shifts, use different influencers, we will. The other thing that we will do is put those messages out so that anybody who does that type of work in the community and would like to put posts out would be able to access that information.
Do you know what firm and how much?
At this point, we haven't signed a contract. We're negotiating price right now, and is it Crumb Snatchers? I'm not sure. I'll have to get back to you on that, Joe.
Next question.
Hi, Andrew William, Media Group. Question for Health Director Harris. You were talking about the younger population not really following the social distancing guidelines. Is your department and CMPD in conjunction, are you looking at a possible curfew for the younger population to kind of, stick it in their head that, look, social distancing in this group needs to happen?
At this point, and the question had to do with whether we're considering curfew, especially for the younger population. What I will say is that we have considered and talked about every potential conceivable way of helping our communities understand the need for the restrictions that we've put into the proclamation. But at this point, curfew is not something that we're actively pursuing.
Next question.
Gibbie, this is Greg.
Just wondering, with the parking lots closed for parks, will there be more enforcement around neighborhoods to make sure that people aren't parking in residential neighborhoods to get to the parks, or how are you guys going to control that?
Yeah, so the question is whether or not, since we've closed the gates around the parks, if there'll be more enforcement in the neighborhoods to keep people from parking in those neighborhoods, and the answers would be yes. That is a part of the enforcement strategy, is to make sure that people are not using side streets and creating additional issues trying to access the parks. Next question.
It's Tony Messiah with the Charlotte Ledger. I have a question. Why are you closing parks that have not been that crowded? Or why are you closing the parking lots of parks that have not been that crowded?
Because we're trying to make sure that we can disperse the crowds across the county. And so by making them pedestrian access only, we limit the number of people who can be in any park at any one time. And so in order to be consistent countywide, we made the decision to close the gates to vehicular traffic in all of our parks. Again, they're open to the public. People should use them. People should take advantage of them, but they just have to get there in a different way and not use their car if they want to get there. Next question.
This is Eric with Fox 46. This is Eric with Fox 46. Question real quick in regards to Miss Iorio. You mentioned that you are urging people to come back. I reached out to Adrian. They said they weren't aware of anyone that had come back just yet in regards to from out of retirement to work within the system. Are you aware of anyone that has come back from out of retirement?
So the question is whether or not we know of anybody who's come out of retirement to come work in the healthcare system, and the answer to that is no. My understanding is at this state website where people can register their credentials, they only have about 450 people who have registered, and that is statewide. And we know we will need in excess of 450 people just to work in Mecklenburg County. And so when I say we need health care workers to come work with us, it's pretty serious. And so I hope people will take an opportunity to think whether or not that's a possibility for them and register their credentials on the state website. Next question.
Gibbie, this is Brett Jensen with WBC News, and I'm curious if South Carolina, they've been putting out estimations now, and they're actually saying for 2,400 people that have tested positive, that their estimations that they're getting from around the country estimates that about 17,000 actually have it because they're asymptomatic or not getting tested. Do you agree with those type of numbers, and would you guys ever consider start using that?
So repeat the last part of that question, please.
Do you agree with those type of numbers that basically for every one person that is tested positive, that there are up to nine people out in the community that have not gotten tested but do indeed have the virus itself? And would you guys consider using estimations?
So we do, the question specifically was about numbers that are being used across the country in terms of estimates in the community for number of positives and whether we would consider using those types of estimates. There are several estimates out there. The 1 in 9, so 9 people for every 1 person who's infected is probably infected. Others that I've heard are 25% of the population at any given time could be infected. I think the reality is probably somewhere in those numbers, but we just don't have the information to know that. We are working on estimations quite a bit of the time, and when we look at the curve, that plays into how we're looking at the curves and determining what we anticipate the needs are for our healthcare systems. Hopefully at some point we're actually going to be able to do some extensive testing and really understand this virus better, but we just don't have that opportunity right now.
Hi, Gibbie. Hannah Smith with The Observer. Can you give me the full racial breakdown of COVID-19 deaths in Mecklenburg?
I actually do not have that information with me. I can look at that, but what I can tell you is over 50% have been African American. The rest have been white, and they're all between the ages of 60 and 93.
Hi, this is Nate Morbido with WCNC Charlotte. You referenced the importance of a full data set when it came to demographic data. What about when it comes to the zip code data? You've released the positive cases. Why not release the negative cases by zip code so we can have a full data set of understanding trends?
There's one very good reason for that is because we do not get demographic information on the testing that's done. So we can't look at the total number of tests done by demographics and determine how many of those are negative. All we get are the specific demographics of the positives. So we just don't have access to that information.
This is Glenn Bergen from Sioux City Metro again. There's been a call from some members of the black clergy to put a testing site on the west side. Where are you in that? Is that something we're going to see?
The question is about testing sites on the in the African American community. We are having conversations with both of our hospital systems about the possibility of having a testing site that would be more accessible. What we would continue to reinforce in any testing site is that we're continuing to focus on those most at risk through the limited number of tests we have available to us right now. So. But we are having those conversations, and hopefully we'll see some action on that soon.
Next question, please.
Gibbie, this is Katie Peralta with the Charlotte Agenda. I had a question about the sickest patients in Mecklenburg County. Of those patients who have been hospitalized and or died, can you tell us how many are considered essential workers? In other words, grocery store employees, people who work in sanitation, et cetera?
The question was, of those who have been hospitalized or died, how many of those are essential workers? At this point, we don't have that data available. When we get positive cases, we do interview and collect that information. We have just not had the opportunity to analyze it at this point. So that's something that we're looking at in the near future.
Okay, we have time for one more question, please.
Yeah, this is Steve Harrison with WFAE. Can you guys hear me?
Yes, I can hear you, Steve.
Yeah, I'm sorry. So my question is the field hospital, can you guys tell us a little bit more about who is going to actually set that up, what it will look like? Do you have any more details about that now?
Yeah, the question was about the field hospital and any more details we have about that. So the way the process works is we identify a series of sites. We give those to the Army Corps of Engineers, and the Army Corps of Engineers has to go and look at every site and evaluate that and make recommendations about which site or sites would be suitable. At that point in time, once we select a site, then the Army Corps will actually upfit the site for our use as a mass care facility. But we're responsible locally for getting the staffing, the supplies, and the equipment to actually make it functional. And when I say we, I mean it's a collective we because we're a team, but the hospitals would be the co-leads on running and managing that. It is essentially a hospital, so you need hospital administrators who are responsible for managing that, and that would be our two hospital systems as co-leads in this case. Okay. We're going to end for today, guys. Thanks very much for your patience today. We appreciate it. Have a good day.